The topic of my Capstone project is healthcare utilization patterns among victims of sex and labor trafficking who receive clinic-based health services. What are their characteristics and what does this tell us about their care needs? What do we know about healthcare utilization among this population? Most of the literature regarding the interaction of victims of human trafficking with the healthcare system primarily focuses on emergency room settings. This study will center on the clinical setting using data extracted from charts review from a clinic that provides services to victims of human trafficking in New York City. The data set includes a total of 137 human trafficking victims who received primary care services at the Purple Clinic between 2015 and 2019. The data was reviewed retrospectively. Number of visits was a continuous dependent variable analyzed against different variables using non-parametric tests and regression analysis. There was no direct data collection taken from the patients themselves. The proposed research did not require an institutional review board review. My two hypotheses were the following. The first hypothesis was that the type of the diagnosis made during the clinic visit, presenting a mental health indicator, acute illness, chronic medical condition, and preventative healthcare measures taken by the medical provider during the clinic visit will be associated with the number of visits to the clinic. My second hypothesis was that older patients will engage more frequently with the clinic. I'm going to highlight some characteristics of the sample reported in Table 1. The age range of human trafficking victims was from 17 to 67 years old, and the mean age was 33 years old. Most patients were cisgender women, 85.4%. The racial category with the highest proportion was other multiracial. English was the predominant language spoken among the patients, and most of the patients were covered by Medicaid insurance, 54%, while an additional major proportion of them, 39.4%, were uninsured. On this slide, I will report on the relationship between patients' characteristics and number of visits. When I ran the non-parametric test, my findings were that among the victims of human trafficking, the medical diagnosis made during the clinic visit was significantly associated with the number of visits patients made to the clinic. Among victims of human trafficking, most of the patient's characteristics were not significantly related to an increase in the number of visits. However, insurance coverage and race ethnicity were significantly associated with an increase in the number of clinic visits. To further assess the association between the number of visits and the medical diagnosis, I ran a crude analysis independently for each medical diagnosis made during the clinic visits. Next, I ran an adjusted analysis for each model, including potential confounders such as age, social determinants of health, and insurance. The services associated to increased visits to the clinic were related to acute, preventative health diagnosis, and social determinants of health. My second hypothesis assessed a correlation between age and number of visits. This hypothesis was not supported among victims of human trafficking. However, one consideration that may have influenced this result is that the sample lacks a larger number among the older patients. As a conclusion, results suggested that higher utilization of clinical services among victims of human trafficking was associated with social determinants of health and insurance. At a policy-making level, free access to quality care will be critical for this population. Federal support to small clinics that welcome this population wherever they seek healthcare services will also be necessary. And enhancing clinical settings where this population can receive long-term healthcare services is paramount to addressing this health issue. Thank you very much.